Cameroon will be joining the rest of the world to commemorate World Sickle Cell Anemia Day on June 19, 2022. The celebration is under the theme Sickle Cell Anemia and Procreation. As objective, this day is aimed at increasing public knowledge on sickle cell. Sickle cell anemia is an inherited blood disorder that causes sickle-shaped red blood cells that can stick together, blocking blood flow and oxygen from reaching all parts of the body.
Sickle cell disease is a genetic disease. It means that for a patient to have sickle cell disease, he needs to receive the genes from his parents. And it's an autosomal recessive disease, meaning that both parents need to be carrier of the disease. What does this mean? If both parents are carrier of the disease, for each pregnancy, the parents have a 25% chance of having a child born with sickle cell disease. This means that there's no 0% risk, and This means that we don't advise two people that are carriers of sickle cell disease, that is two people who are AS and AS, to have children together, because for each pregnancy that they have a 25% chance of having children born with sickle cell disease. So the advice that I can give to parents or future parents, people wishing to have children, is to know their status beforehand. That is knowing if you are AS, if you are SS, or you are AA, because this is very important, and this will help you to have a child that is not born with sickle cell disease, because sickle cell disease comes with acute and chronic complications.
Though explained by science, living with sickle cell is definitely a different situation, as it turns out to be quite demanding and difficult to explain, as Fuekwet Ranier Salamatu speaks out.
Living with sickle cell is not that easy for a sickle cell patient. As a sickle cell patient, we suffer a lot from pains, we suffer from crises, we suffer from talks from left and right and all the like. So if you have a sickle cell patient in your surrounding, please be very careful with the patient. Talk to him with kindness and all that, because no one loves to be sick. No one has chosen to be sick. I myself, they asked me, Salma, will you like to be AA or SS? I would choose to be AA, obviously, to be normal.
Though hard to comprehend, sickle cell can be managed by living a healthy and good life.
Then, as a sickle cell patient, you need to drink a lot of water. You take your folic acid. You eat a lot of vegetables and fruit. You have to take away every stress that you undergo on. I know it's not easy, but at least stress is not favorable for sickle cell patients. It can lead them even to CVO crisis or STA crisis, it depends. So,
on an occasion like this, society is encouraged to be positive, supportive, and exhibit social inclusion of sickle cell patients.
We came this morning to bring our support to those who live with drepanocytosis. So we know that it's not easy. It's not easy to have a child or to be somebody that lives with drepanocytosis. So we want to support them. We want to bring our financial and moral support.
Knowledge is power. Solidarity is wisdom. Inhabitants of the city of Douala encouraged to join the movement at La Cantini Hospital and be part of the association to lean and be leaned on.